Welcome to another edition of the Corner Booth Podcast here at the Snowdon Delicatessen. I'm Aaron Rand from CJD, along with Bill Brownstein of the Montreal Gazette. And joining us today is Sylvia Martin-Laforge, the Director General of the Quebec Community Groups Network, and Montreal lawyer Eric Maldoff. Eric, your resume is too long to list. So you, for people who don't know, Eric actually was the person who started Alliance Quebec back in the early 1980s here in Quebec. Correct. And you've been dealing with healthcare and social services, been very involved in that since the get-go. Thank you, first of all, both for being here. So, not much news in healthcare these days, is there? No. But let's start. Let's start with one thing, and that is the QCGN. Sylvia, I know we had a chance to speak earlier. There was some question as to whether, when this meeting was called with English language groups, whether you had been invited or not, you being the QCGN, representing Anglo groups across the province. And there was some confusion as to whether you were invited, weren't invited. Was it a last-minute invite? What actually happened?
We heard that the minister was inviting people the week before, the Friday before. We never got an invitation. We never knew quite who was invited. And by the Tuesday, we knew that meeting would be held on Tuesday. By Tuesday, we had not gotten an invitation. Tuesday morning, I got an email saying, would you like to meet the minister at 12 o'clock for 15 minutes? I was busy doing something else, so I didn't see my email. And so at 12:05, I see the email, and it's, of course, too late. So I write them back, and I say, well, it's too late. And they say, well, how about 3 o'clock this afternoon? And I say, well, will the Minister of Health be there? And they said no. And so we said, we'll pass then. So the meeting had already taken place. It was my understanding at 11 o'clock. And this was going to be a private meeting with Minister Roberge and the QCGN, which we had always said we didn't want. We wrote a letter to Minister Dubé, and we asked him for a meeting with the Minister of Health.
And that was not going to happen, and you had no confirmation that that would happen.
We've only had an acknowledgement letter, but we haven't had a letter from the Minister of Health saying he will meet with us in the future. We're still waiting.
Some people may wonder, you're offered a chance to meet the language minister, who's been really the front person for this, even though people wonder where the health minister is and where the minister responsible for relations with Anglos is. Jean-François Roberge has been there. He's the face of this debacle right now. Why not take that meeting? Why not at least hear what he has to say?
We had conferred with our members, key stakeholders, key leadership in the English-speaking community, and the feeling was, and the approach we were committed to, all of us, was that we would not treat this as a language policy issue, but rather as a health and social services care issue. So that's why the request to meet Dubé and to meet Dubé was so important.
Okay.
Eric, the bottom line to all of this is now there's going to be a new directive coming out. But if nothing impacts the Anglo community, what was the need in the first place? This is such a murky situation, it makes no sense.
Well, your problem is you're being logical.
No.
The fact of the matter is, if nothing's changed from before Bill 96, then there's no problem, because the way it stood was, and in the guidelines for the creation of access programs for English language health services, a person was an English-speaking person entitled to service if their preferred language of service or they were more comfortable receiving their service in English, period. That was the end of it, and it worked, and there were no problems. Occasionally there'd be a hitch here or there, but fundamentally there were no issues. Nobody got prejudiced by that. They brought in Bill 96, brought in the concept of historic Anglos, brought in the idea that it's exceptional to give them service, whoever those Anglos may be, and created total confusion. The directive really just follows on from the law that they adopted 2 years ago. And what's happened is they've put all the provisions that were spread out over Bill 96, which is a big, thick law, and it's all in 30 pages now. So most people can actually see all together what the picture looks like, and the reaction is people are horrified by it. They think it's crazy.
But, you know, we both heard, everyone here has heard that famous quote from the Premier back in 2022.
Right.
saying absolutely nothing changes with respect to healthcare and social services by way of Bill 96. He was very clear about that. The same thing is what the language minister said as well. So where is this confusion coming from? Is this, as people have said, the left hand not knowing what the right hand is doing?
This is deliberate. This is an attempt to pander to their clientele and basically saying we're turning the screws on the use of languages other than French, including in the health sector. That's what the law says. Then what they say to the public, to us, is, what are you frightened about? What are you worried about? Nothing's changed. That's just outright false. And I do have to mention, when Sylvia says that they weren't going to meet the Minister of Language about a health issue, the Gazette's to be credited for the article that appeared yesterday where they actually quote the minister as saying, because he made a distinction, the real thing is that we were intending to deal with administrative matters, not the delivery of health care. That's nowhere in their directive. But on top of that, the Gazette asked him, so what does that mean in terms of administrative matters in health? Answer by the minister, I'm not expert enough in health to answer the question of what that means, which goes right to what Sylvia said and what everybody's saying. This is a health issue. The person who's trying to regulate the most fundamental aspect of healthcare is communication. If there's no communication, there's no delivery of health and social services. It doesn't exist. And this man and this department is purporting to regulate the very means by which delivery of care takes place.
I want to just point out to what you just said, this is fascinating. When I had the minister on my show and I brought up the issue of administration that he used, his example was, if you want to know how many ambulances go to the Jewish General Hospital over the course of a year, and that's the request you want to make, that's where this directive would come into play. That's actually what he said. Then a day later, he said, if you want to paint a wall in a hospital and you want to get the contract, that's where this would come into play. So that answer has changed now 3 times in the course of basically a couple of days. It's clear he either didn't know what this was about, so maybe his last answer is the most rational of all. This idea, this is not really my purview, I can't give you an answer. He doesn't know.
Correct. And that's a major problem. He's purporting to regulate. Every study, there's a huge body of knowledge on this, and any normal, rational person understands this. Effective communication is an essential component for safe and delivery of health care.
You talk about the fact that Mr. Dubé didn't show up, but what about Mr. Girard, the guy who was basically our Anglo affairs? Wouldn't this be under his mandate as well? Wouldn't he be advised to step in?
So a few weeks ago, QCGN met with Minister Girard, and we talked about the hot dossiers in the English-speaking community, and the first one he mentioned was health. And he said, actually, he had met with Eric Maldoff, and he told him that there was no problem, and why didn't we believe this? So he went from health to education to higher education, and j'en passe. And so he said, we are paying attention to what you're saying. This was barely a month ago.
Right.
Barely a month ago. So either the left hand doesn't know what the right hand is doing, or there's a serious obfuscation here about their intentions around the English-speaking community.
Is the sense that you're getting here collectively as I'm hearing this, and I didn't know about Eric Girard, it seems to me, maybe I'm wrong, back in the day when Christopher Skeet was the CAC minister responsible, and we would talk to him on a fairly regular basis, he met with QCGN pretty regularly, did he not?
He did, and I'd like to remind us all that in 2019, in the fall, Minister Jolin Barrette at the time had made some kind of comment about historic Anglos. And I had occasion to meet Christopher in that November, and I said, what is he talking about? And Mr. Skeet at the time said, no, don't worry, it's just an off-the-cuff remark. That was in 2019, and they were starting to talk about historic Anglos. I think you had a T-shirt about that.
Right about that time, yeah.
Yes.
And so when they say something, they mean it. And that was 2019. So they were already thinking about importing what they do in the health in the youth sector into other sectors. In the health sector, this is ridiculous. There's no mechanism, number one, and you wouldn't want a mechanism to have a little red dot on your health card to say that you're an Anglo. Health and social services, as Eric so forcefully and calmly says, is universal. And we should have universal access to health care in Quebec as English-speaking individuals.
I'm trying to understand now. This seems to be, as I hear these stories, we're being basically patted on the head by this government, being told, don't worry, nothing changes. Yet you're both saying we are wrong to think that that's in fact the case. The language used, I think, by the language minister was, we will clarify, or we'll try to clarify what's in this directive. Then it changed to, we're going to redo what's in the directive, but never did he say, we'll scrap the directive we have now and start over. Is that the concern?
Well, the first issue is, if he now acknowledges the directive is off base, which he seems to be doing, then withdraw it. But you can't have that in force with him acknowledging that it's wrong. That doesn't make any sense at all. So why is he leaving it in place? I don't think this is a good faith exercise. And there's another aspect of this that few people talk about. It is something I raised with Girard when I met him, who I like. Very nice man, very thoughtful guy. I think he's been told, keep your hands off this file. That's the truth. And I think everybody else has been told, this is the Premier's baby, and he's given it to one of his favorite children, and that child is running around handling this, and every other minister has been told, shut up. But one of the other provisions in this directive, not in the directive, in Bill 96, which nobody's talking about, says that you can't, everybody respects the right to work in French. That is not a debatable point. But it says you can't require, in hiring, promoting, transferring someone, a knowledge of another language unless you've taken all reasonable measures to avoid that requirement. And then it goes on to say you will be deemed, which is an irrebuttable presumption, you can't prove otherwise, you will be deemed, the employer will be, and it's offense under the Act, if you cannot prove that you have restricted to the maximum extent possible the number of positions in your organization that require a knowledge of English. Now, let's look at what that means. We have bilingual recognized institutions under Bill 101. They continue to exist. How do you deliver service if you can't staff with people who can deliver the service? And if you make it an offense under the Act to require that, and the employer has to go through hoops to try to prove, how many of the non-English institution managers who are overwhelmed are going to waste their time trying to argue to hire somebody who can speak English? And in the English institutions, they're overwhelmed with work. They've got tons of stuff, understaffed, and their management is now to get into a fight with the Office de la Langue Française over the fact that they want to make English a requirement in a bilingual institution. So it's a chilling effect all the way across the board. This is where they're at. This is not a friendly, good faith, accidental matter. This is deliberate, conscientious. They do want to wipe English off the map as a public, as a legitimate language in Quebec. You want to do it privately, do it privately.
You're suggesting, or more than suggesting, that this is all done to curry favor with the base in the regions, probably, but I don't even understand how this is going to help the CAC. I mean, how does it, basically, I mean, the PQ is way ahead in polls at this point in time. I don't understand the rationale.
Doesn't this play to the whole, well, look, we're protecting French, we're promoting French? That's what they've done from day one.
But it doesn't even impact, though. That's the lunacy of it.
It's a political
right.
play.
It's like with McGill, it was a whole other game. But this is like even beyond all of that.
No, but Billy, you've got to look at what they've done. This is an appel à la nation. And it's disloyal not to salute as soon as somebody does that. But if you track, and I've done this, look at their behavior as a government since they came into power. Every 4 to 6 months, they pick an issue and attack the English-speaking community with it. Right off the bat, they cut the project for the expansion of Dawson.
Right.
Unilaterally,
Right.
We're giving it to the French. It wasn't even that there's a problem with this. We're giving it to the French. They went on from there, Bill 96, the reform of the Health Act, every single one of these things hits the English-speaking community. Then you hit McGill and Concordia, and now they've cut budgets for their buildings and stuff, so they're going to have to cut back on their development. I've asked the question, is the Royal Victoria project of McGill on or off? And to date, I haven't been able to get an answer.
Really?
And they've invested 10 years in trying to advance that.
The Corner Booth podcast is brought to you in part by the Snowdon Delicatessen, where we are. 75 years in business, the home of Montreal's greatest smoked meat, plus carnotzel, potato latkes, and the famous Snowdon Deli party sandwiches. That's the Snowdon Delicatessen. I want to go back, and I know we're kind of ranging a little wider here, but with respect to the directive, so people understand, this 31-page document that you're referring to, there are specific examples within that directive, right, of when and how you can be provided service in English in the healthcare system. To me, that seems the most egregious part. I don't know how you can deny that it's there and then say it has to do with administration only.
And for each directive, there's for each example, there might be 10 others or 12 others. It's the frame of it is to make people question whether, in fact, they have a right to speak French or to the patient, or the patient has the right to speak English to the caregiver. Everywhere in there, first of all, the directive is in French, so they're fat, and everywhere it says peut, they may, peut. So it is left to the judgment of the provider of service. That is that's not active offer of service here, because an individual is not given the right to decide on their own judgment whether this person is French enough has enough French to understand or not enough French to understand. This is permissive on the provider. The directives don't make any sense. The directives don't make any sense in the examples they give. And also this insertion of a certificate makes even less sense.
Right.
So
the certificates you can't get even if you wanted to get them.
You can't get them.
Right?
So you want it scrapped immediately.
We have said scrapped immediately. Eric and others in our leadership group want it scrapped immediately. If in fact we don't want to come back enough, no directives in health and social services. But if they want to even look at them again, they should at least suspend what they're doing now.
Right.
It is not in good faith.
So you have no idea how long it's going to take to put together another directive. I mean, this could go on for months.
Well, maybe Eric has an idea, but it takes.
Why would they be in a rush?
Well, that's my point.
Left this in effect.
Well, yes, that's
So
my
they can
point.
take
So
until
they
the
could
end
take
of the
2
mandate.
years until another. Exactly. Yeah.
Yeah, until we get to the point where someone, in a practical example, ends up in a healthcare setting, wants to have service in English, and then finds out they can't get it because, and I think this came up when we originally talked about this, if you violate a directive, you actually face, I don't say prosecute, you face a
Employment
penalty,
sanctions.
right?
Employment sanctions. If your boss tells you this is what you're to do, and you say, well, I'm going to ignore that, the next thing you know, you get hauled up on disciplinary measures. Remember, that's the most important enforcement mechanism that they have in this bill. There are penalties, there are fines, there's all sorts of things. But fundamentally, they've put it on the employer to ensure that the law is respected in their organization. So anybody who doesn't respect it, there can be an anonymous complaint. The employer's got to deal with it. If they don't deal with it, the employer then becomes responsible, and the employer in the health sector is an employee of the Minister of Health. So he can be fired, or she can be fired.
You know, last week we had a guest, Dr. Laura Sang, who is an Anglo-Montrealer who works totally in French, and she brought up very interesting points about just how this might impact our doctors, our medical professional, who either going to retire, they don't want the hassle, or they're going to go private, or all the rest. This is going to have a huge impact if people react that way, and our health services are already a little bit chaotic.
The issue is, against the backdrop of what the conditions are in the health and social service sector right now, it doesn't take a lot to push people into saying, I've had enough, I'm quitting. We know that's happening with nurses. We know doctors are getting out of the system and going private. And all of this stuff just causes people to say, what do I need this for? And will just augment the crisis we have in shortage of services. That's all.
Yeah, it's really sad.
But this directive, I would say, if the CAC follows its routine, we can expect a new directive in about 6 months, because that'll be the next time on their 4 to 6 month rotation to come and stick it to the English-speaking community again and create another crisis. I assure you this directive, when it comes back, if it does, will not fix the problems, because they're in Bill 96.
And we all remember that Bill 96 is under the notwithstanding clause.
I would ask one other thing, and again, it's a hypothetical. Let's say you're that English patient who can't get service in French. What do you do with respect to complaining about it? Can you file an anonymous complaint? Where are you going when that happens to you? Is there a mechanism in place?
Well, first of all, there is a formal complaints process for a denial of service within the health and social service sector and in the law. So people could file a complaint that they're not getting service. The issue is, if the defense to that complaint is, I'm just following the law, then the complaint goes in the garbage can. It's going to be ambiguous. We don't know how that'll turn out. You go and file your complaint, the complaints commissioner will say, well, the law is the law. Then the complainant will say, well, the minister said I can get service. Now, I do want to not terrify people here. My experience with the health and social service system is there are very few people in that system who are malicious ideologues who want to deny service. Somebody's in front of them in trouble. They're going to likely get someone to try to take care of them. That's just the way it is. And that is a good thing. But why would you put a chill in when people have to start thinking twice? And everybody should understand, when we talk about health and social service, everything's doctors, hospitals, nurses. This is social workers, physiotherapists. This is the intake clerk at the hospital when you show up on your day of surgery. This is the discharge clerk at the hospital when you're trying to get out. This is all those. This is the orderly who sees you fall off your bed and has to help pick you up or whatever. It's everybody. That's who delivers health and social services. So when the minister says, well, administrative,
however nebulous that is.
Further confusion.
Yeah. So I guess it's fair to say we can agree this is, you tell me, a solution to a problem that doesn't exist. No one I can't think of any problems that have come up where I couldn't get service in English. As you just said, overall, for the most part, this isn't an issue.
Overall, in the real world, it shouldn't be an issue. It hasn't been an issue. I think they're trying to make it an issue,
yeah.
But it has not been an issue. Occasionally you hear a francophone complaining that they weren't allowed to speak French or something like that. But this is such a minute experience that it's dealt with every time.
These people in the health sector, for the most part, it's because of a vocation. They don't have another thought about linguistic issues. It's a vocation. Right. They go in there, they want to help people, and why would we encumber them with another level of judgment around triage on language issues?
And where this comes up, the encumbrance, is it's a vigilante law. Anybody, any third party can file a complaint that somebody has violated or is about to violate. I don't know how they know that, but or is about to violate the Charter of the French language. And that complaint has to be taken seriously and has to be investigated. So part of the chill factor is somebody is serving, and they have to worry that somebody in the waiting room is there from the Société Saint-Jean-Baptiste or from the CAC and files a complaint. And the next thing
this is where it also, the Santa Cabrini Hospital, this is where everything blew up, because they thought that this was going on. There were snitches in there, there were inspectors checking, and nobody really put aside those rumors or claims or whatever, and it made people hugely uncomfortable. And then from that, of course, is what we have now.
The government is very happy to announce that complaints have gone up, I don't know, threefold, tenfold. So the snitch factor is everywhere.
Right.
We're out of time. I would ask you both a question, though. Maybe this is not the right question to ask, but after this discussion, are you hopeful, is hopeful the right word, that this does get changed, or do you think this is just going to be kicked down the ball, ball being kicked down the road for as long as we can without any substantive changes?
Personally, I'm not that hopeful with this government. I'd love to be surprised. The only thing that really keeps me going is I have a lot of friends who are French-speaking. I work with people who are French-speaking. I'm involved in the health sector. A lot of people are French-speaking, and we all get along. And the people of Quebec are good people, are kind people. This is a nice place to live. And I have faith that the people of Quebec, in due course, are going to just say, this is crazy, this is a distraction from us building our economy, building our education system, doing all those things that really need to be done. And beating up Anglos may have been an interesting sport, but people get tired in overtime.
We hope.
Well, I think they will.
Sylvia, hopeful?
I'm always hopeful that the community will band together and tell the government that this is not the right thing to do. Over the next few weeks, we will be continuing our request to meet with the Minister of Health. We will be suggesting to scrap or at least change directives. And so I think we must not give up this fight of making this go away in the health and social services sector. Can't speak for all the sectors, but certainly the health and social services sector.
One other point. I would hope that, and there's the beginnings of it, that the Government of Canada, that is responsible for the Canada Health Act, which is supposed to guarantee accessibility to health and social services, has spoken out and said those services should be available in French and English. And that's the first time they've said anything nice or heartwarming to the English-speaking people.
They don't want to alienate the voting
Well, we're
audience.
coming up to an election.
Of course.
That's what elections are for.
I hear a letter is forthcoming, though, from the Minister of Health.
Hopefully.
We'll see.
There's that word, hopefully.
Hopefully.
I want to thank you both for being here. Sylvia Martin-Laforge from the QCGN, Eric Maldoff, thank you both. Appreciate
you.
it.
Thank you.
All right, we'll see you again
Thanks.
soon on the corner booth.